Greetings, everybody, and thank you for joining us from wherever you are in the world. I would like to welcome you to this session during which we are going to explore how a market systems development approach has been applied to improved nutrition outcomes. So as you enjoy the discussion we have today, please do engage with us through the SEEP conference discussion forum and ask your questions and share your experiences as you will. I am delighted on this occasion to be joined by a panel of experts, among which we have Adriano Scarampi, who is the advisory practice lead at MarketShare, Meredith Stakim, who is the regional technical advisor for nutrition and health at CRS, and to recognize our good friend and contract officer representative, Verena Ruzibuka, who is also agriculture and food security specialist at USAID. My names are Dennis Karamzi. I'm the chief of party at Orora Wihaze, which is a Feed the Future program here in Rwanda. So through our discussion today, we expect to learn, and we expect to learn through our team's experiences through both humanitarian and development programming, and to learn from their experience applying a market systems development approach for nutrition outcomes. We will use the case of Orora Wihaze Rwanda, and we will share the strategies we have pursued as we have applied a mix of approaches as Rwanda faced COVID-19 challenges, like many of the other countries. Our team will also be able to answer a number of questions, among which we want to understand the blend of skills and experience that can make programs more agile to respond to sudden protracted crises. We would also like to ask a question about how the teams have come together to apply market systems approach for nutrition outcomes. And most importantly, we want to hear from USAID. What do you have for other donors and implementers who are looking at adapting this approach for their programming? To begin with, let us go to the project Orora Wihaze here in Rwanda. The goal of Orora Wihaze is to increase availability, access, and consumption of animal source foods through the development of a profitable market. And we have two key objectives that drive towards the achievement of the goal, which is to increase demand for ASF consumption for women and children and strengthen private sector-led animal source foods value chains. So our project, as I mentioned, has particularly been hit by COVID-19 as many other projects, and with multiple disruptions across the systems. And some of the constraints were that producers were at risk and egg products were expected to be lost. And there was potential for severe malnutrition at the same time. So we'll be able to learn during this panel discussion how the intervention enabled Rwandan egg producers to deal with the potential for a domestic market collapse and supported households to access eggs. So I now would like to switch over to the panel, and I invite Adriano Scarampi, who I introduced earlier, to share with us how, as a program, we have been able to apply a market systems development approach in Rwanda, particularly towards the project context here. Over to you, Adriano.
Great, thanks, Dennis, and hi everyone. It's great to be here with you. So, as Dennis has anticipated, Orora Wihaze is a market systems program with a nutrition focus. This means that it aims to sustainably transform systems so that people have better access to and consume more of the right protein-rich foods. So what does this mean in practice? How do you actually implement a program with this set of objectives? Well, to start, as part of our diagnostic process, we try to bring together into a cohesive strategic approach both a deep understanding of nutrition behavior and a deep understanding of market systems constraints and dynamics. So the starting point from a nutrition behavior perspective, if the ultimate goal is to ultimately improve the consumption of animal source foods, we then had to understand what are those behavioral factors that we need to leverage to get households to consume more of these foods. For this reason, we conducted a a consumer behavior assessment and developed a nutrition behavior strategy that informed our program design. To give you an idea, what are households not consuming food because it's not available, it's not accessible, or because of social norms that influence their behavior? These are some of the examples that we looked into. From a more traditional market systems approach, instead, we have spent considerable time speaking to system actors, understanding relationships between them and constraints. We then developed a scoring systems that allowed us to reflect on the importance of each market system's constraint and which ones should be prioritized by the project. For example, if affordability or access are identified issues stopping the consumption of the right foods, then what structural constraints do we need to prioritize and target to achieve our outcomes? And what market actors we should work to address them? We brought these learnings into a cohesive strategy that looked at both demand and supply side intervention strategies in an integrated fashion. These issues are linked. You can't increase supplies or improve value chain efficiencies if this is also not met with an increase in demand. In this slide, I kind of wanted to tell you a little bit about how we thought about our intervention design. And this is just for illustrative purposes. It's not necessarily we didn't specifically use it in this specific way, but what this diagram is supposed to show you is that what we do on the project is we discuss openly to what degree we always want to be facilitative as a program, accepting that at times, especially in the early stages of implementations, we might need to be a little bit more hands-on and use interventions as a learning opportunity. How does this mean in practice? We recognize that, especially when working on the demand side, we sometimes need to be a bit more hands-on, in part because we need to work with market actors that are not strictly defined in MSD terms as permanent market actors. For example, some aspects of our work do touch on models and work with market actors, for example, around nutrition awareness, that often are community-based organizations, NGOs, and even faith-based organizations. Working with a broader range of actors allows us to move a little bit faster, test and learn multiple approaches, and see what works and what doesn't. An example of how we adopted a more flexible approach is in the model that Dennis introduced in the earlier slides. As mentioned earlier, the COVID-19 crisis amplified an existing issues in the egg supply chain. So we took this opportunity to step in, respond quickly, and build trust with local institutions. We collaborated with a wide range of actors to facilitate and introduce a voucher system that links suppliers to markets. And we subsidized this to an extent. This allowed us to expose weaknesses in the system and the current poor resilience of the domestic market to all of the market actors. And we were able to do this thanks to our geographical reach and our deep understanding of both supply side and demand side drivers. Now, following this pilot that perhaps wasn't strictly sustainable in the long term, we are looking to design a sustainable long-term solution with all the market actors that we were able to build relationships with during the time of crisis.
Thank you very much, Adriano, for that good introduction into the MSD approach in times of crisis. I would like to follow up with a quick question. So the MSD framework can already be quite cumbersome in terms of analysis and strategy design, which often leads to analysis paralysis and delays in implementation. So the approach you just presented adds another layer of complexity to the traditional approach, as you alluded to. So how have you mitigated this analysis paralysis risk?
I mean, of course, it's challenging, and we did add a pretty complex layer of analysis. So we took two strategies to try to mitigate this. On one side, we tried to keep the market systems analysis lighter and more practical. Instead of delivering the usual 100-page documents, we kept it on PowerPoint in a format that is quickly editable and that we can build on as we implement. From an operational perspective, we try to really push the team to learn on the job. and to try to strike the right balance between knowing everything and spending time validating all the assumptions before the launch of activities, and knowing enough, knowing what you don't know, and learn as you go. But this is like what we try to do in theory. Actually, I'd be more interested to hear from you, Dennis, whether our initial approach actually was feasible. How do things work in practice?
Yeah, well, I think so far so good, I would say, and thanks to your explanation here. I just want to add that I think it was important to roll out as one team, because I think a lot of the effort is usually spent around building a team and kind of building a consensus around the same understanding. So we've been able to leverage team expertise across the board within the consortium, but we've also kind of worked quickly to adapt a sequencing that allows us to push forward things that can be implemented in the immediate kind of time. And this speaks to a focus on what I could call quick wins, the understanding within the team that a few things can be a bit of low-hanging fruit. So we've built around that to make sure that we are not caught in this paralysis. So thank you very much. I hope that helps. So I want to turn it over to our colleague here and the panelist, Meredith Stackham, who I introduced earlier. Meredith, please help us understand some of the approaches we have wrestled with to apply a nutrition lens to MSD.
Thanks, Dennis. I think I can say that this project and the MSD lens has really made us think about our nutrition work in a new way. Typical nutrition projects mainly work with the food consumers, and they try to educate them about what a healthy diet is, and support them to eat that diet, to make those choices. And the nutrition colleagues among us are familiar with many of these kinds of interventions. Things like counseling card supported, home visits or group sessions, cooking demonstrations, etc. But these interventions only look at one side of the system, the consumer side, and they concentrate on conscious decision making at a time when there's growing research about how influential unconscious decision making and the environment can be. The nutrition community has worked with supply side issues before, such as legislating iodized salt or fortified flour, so consumers can reap the benefits of those interventions without having to choose them. I think it's fair to say we've only begun to scratch the surface on the potential of looking at a food system rather than just a nutrition service. And we know that consumers are influenced by what is available to them and what's affordable. But I think we've underestimated in the past how influential these supply, commercialization, packaging, and other factors are in influencing those consumer choices, especially in rural areas. What's being produced and marketed and how it's marketed, distributed, and sold actually has a huge influence on what people are buying and eating. So overall, this approach has helped us bring that bigger perspective, and I think it's a little bit exciting and a little bit scary at the same time. So let me share with you a bit why I think both is a good description. One of my biggest fears is how few successful examples are out there to draw from. We don't have an example in a market systems development for nutrition approach that we can turn to and say, here it's working well, and we can just copy this model. We're definitely forging into new and uncharted waters, and we're going to learn a lot as we go. And I think one of our biggest fears is around this possibility of unscrupulous marketing. Can we really count on companies who are generally ultimately most interested in their bottom line to put consumer needs and interests on their priority lists? Or will they cut corners to make a quick buck? Will they overstate the health benefits of their products, or intentionally confuse consumers to boost sales? I think the experience from the US and other places says, this is a very likely possibility. I think another, specific challenge that we've had with our project is that we're trying to reach local women and children, but a company might be able to make more money by exporting the same product, or at least moving it into cities where consumers are willing and able to pay a higher markup. And that was one of the things we saw in the egg supply chain, our value chain in Rwanda. And so bringing this lens of how can we motivate them to meet the needs of our target low-income consumers, is a challenge, but it's also quite an opportunity, I think. And I think bringing together the MSD and nutrition really forces us to think about the whole system in a way that is likely to bring out a richer and more nuanced understanding of the opportunities and gaps. I consider a context where healthy food is available and affordable and just becomes what people buy at the market. The possibility of creating that kind of a food system really excites me. As we strive towards that, we're not just looking at what people should eat or what's profitable, but we're trying to bring both lenses together and create an environment where people can affordably access the healthy foods they need, and producers can profit. And we know that profit can be a huge driver. If the system is profitable, it's so much more likely to be sustainable and to even expand. I think we definitely have in mind some of the potential pitfalls of private sector leadership in nutrition. I think there's so much untapped potential to collaborate with profit-driven companies and engage them in creating and marketing healthier products. And that's something really exciting about this market systems development for nutrition model. I think that part of the cost of nutrition services that we currently deliver could be borne by food producers rather than by governments or donors. And this is something we're looking at in the project. Why not? They stand to gain when more people buy their products. Shouldn't they be invested in promoting those products and helping consumers understand how those products benefit nutrition? And I think we're also conscious the biggest food companies have some of the best and most creative advertising, allowing them to reach consumers in new and creative ways that are much more effective than our health promotion sessions. So to me, ultimately, this market systems development approach has been an opportunity to expand how we think about achieving nutrition objectives. Striving to strengthen those linkages between environment, natural resources, producers, processors, food markets, health, water and sanitation, nutrition. It's no small task, and we certainly won't be doing away entirely with our proven intervention mix of supporting community health workers and organizing cooking demonstrations. These are still very much part of our plan. But we'll be looking at how we can do them with a new twist, like getting producers involved in food demonstrations, working with processors and retailers to make smaller packages available and meet poor consumers' purchasing power and interests. And we'll be learning a lot, I feel like, as we go, and hopefully next time there will be more of a track record for others to build on.
Thanks very much, Meredith, for your good discussion here. Can you tell me, did your thinking about MSD and nutrition change at all because of the COVID-19 pandemic?
That's a great question. Not dramatically, and I think that really speaks to the strength and the versatility of the model, that it remained a valid way of looking at the system regardless of shocks like COVID-19. But I do think the COVID-19 experience brought several points to the forefront of our thinking about MSD for nutrition. It really brought home this interconnectedness of food systems. We saw how a closed border or a movement restriction in one area could really disrupt availability of a food product in another place. And we saw that with the eggs that Adriano spoke about earlier. And I think it also underlines the importance of thinking about the system holistically and understanding and considering those disruptions and the potential impact of shocks. I think secondly, it really brought to the forefront this idea, the importance of being creative and thinking outside the box in how we deliver services. Nutrition has tended to rely on face-to-face interactions. That's been very foundational, but those just couldn't happen in many places for months. And I think it really underlined to us how we need to think creatively about how to deliver. And this is really an area, an opportunity where the private sector can be useful in bringing new ideas to the forefront. And lastly, I think it reminded us of the potential of humans to catch disease from animals and how important animal health and food safety will remain in our project and our efforts going forward.
Thank you, Meredith. I now want to move over to Verena Ruzibuka at USAID. Meredith just talked about some new innovations that are always required. So we would like to know what inspired USAID to look at the problem at ASF consumption through a market systems development lens.
Thank you very much, Dennis, for this opportunity to be part of this panel. So, as you may all know, chronic malnutrition, especially stunting and micronutrient deficiencies such as anemia and vitamin E, remain to be stubborn indicators for Rwanda for many years. And with time, we have realized that the main cause of this situation is poor dietary diversity, specifically lack of animal source food consumption. So USAID has learned from its previous or existing investments in nutrition that with time, people's knowledge on what to eat has improved. However, demand for consumption of diverse diet, especially animal source food, still remains low. So the major causes for this slow behavioral change, despite of all the improved knowledge, is scarcity, affordability, and limited access of animal source food products, especially in the rural areas, and for the target population, especially women and children. So nutrition being a multi-sectoral challenge, we learned that a lot of unlinked pieces have to be linked in an organized manner or in an organized system for us to reach the nutrition outcome we want to achieve. So again, we continued and did further analysis of the animal source food market system, and we identified different systemic challenges and opportunities that we thought it's necessary to think and try to address through strengthening animal source food value chains. And while the work to increase efficiency of animal source food value chains continues, it was critical to continue working with the communities, with households, to increase demand for animal source food consumption, building on the knowledge that they have, and at the same time linking the two. So again, we also learned from our other existing market system facilitation programs, especially in the economic growth office in different value chains. And USAID thought it's a high time to address this nutrition challenge through a market system approach.
Yeah, thank you. Thank you very much, Verena. And what advice would you have for other donors and implementers who are looking at adopting this approach for their programming?
Oh, thank you, Dennis. That's a good question. Building on just what Meredith says, that there are no many examples out there, Orora Wihaze is the first missions market system activity for nutrition. So these are exciting times, I would say. We look forward to bring out or to draw a lot of lessons from this activity to inform our future investments. So we hope that this activity, or Wihaze, will bring an opportunity for the mission and other stakeholders in place, including other donors, the government, other implementing partners, to learn from this fast-moving market system, like the animal source food system, and then test new innovations to address the existing challenges and adapt different ways that will work to achieve our nutrition goal. So I think it is a high time for all market facilitators, like all donors and implementing partners, to open our eyes to learn from system actors, the private sector, the local organizations working with the households on day-to-day, the local government, and the entire operating system, and try to adapt accordingly. And then I also think addressing just a piece of a problem, if it's behavior, just looking at behavior without looking at what are other factors that influence people's behavior, will not address a critical part of the problem. So it is important to look at the challenges we face in this nutrition program, being a multi-sectoral sector. Looking at it in a more holistic way, in a system, in an organized manner, in an unorganized system, to address these stubborn indicators like stunting. And then another point, I think it's important to remain flexible, and especially in areas or in perspectives where there's a need to blend the market facilitation or market development approach and the non-market development approach to implement different interventions, because market actors or the target population we want to achieve may be incentivized to change their behaviors, maybe with a blend of these interventions. So I think flexibility remains critical at that point. And then coordination and collaboration of all stakeholders is very important, all the way from the design through the implementation of different interventions. So all partners, development partners, civil society organizations, government and private sector are key stakeholders, are key actors in this market system that we are trying to operate. We are trying to incentivize their behavioral change to achieve our nutrition goal. So one activity, one project alone may not be able to reach all the target groups or the target population in a country. So coordination and collaboration is very critical, depending on where each donor, which implementing partner has a comparative advantage. So, and the maybe last point, again, information sharing is very important, all the way again from the design of programs to implementation, because that will help us to avoid duplication of the interventions we are trying to put in place. So just a quick example, Dennis talked about the collaboration and coordination that took place during this egg market failure interventions that Orora Wihaze came with. But it's not all about Orora Wihaze. Orora Wihaze addressed the challenge in one part of the country, but a similar challenge was happening elsewhere in the country. So at this point, there was a good coordination and collaboration with the government to strategically target which program or which activity can support actors from which area. So finally, all development partners who are willing to participate in addressing this challenge were strategically positioned to address it at the right place where they have a comparative, I would say, advantage, and the challenge was resolved within a short time. So I think that was a very efficient way of doing business and addressing the system challenge, at least during crisis, but even in situations where there's no crisis, I think this is important. Thank you, Dennis.
Yeah, thank you too, Verena. Speaking of crisis, I just wanted to know, in light of COVID-19, what opportunities do you see from the project coming up in the next couple of years, if any?
Okay, thank you. It's interesting, yeah, COVID crisis has taken long than maybe we thought. And COVID crisis is just one of the crises that we are in, or we are still in, but crises keep coming. Maybe another time, a few months ago, there was locusts, sometimes there's drought, and they all affect or how market actors behave or the way they do business. So I think with the COVID crisis, I think it has brought an opportunity for us to learn a lot, because a lot of things have changed. A lot of actors have been pushed to do business differently. So a lot of failures or gaps in different systems were clearly seen during this period. But at the same time, a lot of innovative ways, some of which Meredith mentioned and Adriano, were put in place to implement activities and reduce total failure, I would say, of implementation. So I think this is an opportunity for us to take note and learn. And then again, this crisis has pushed us, or has challenged everyone to continue to be creative, addressing different gaps, and come up with sustainable solutions, because some of the solutions, some of the ways we do business are short term. And when crises like this come, we are totally hit. So I think partners have been pushed to think differently, and even other stakeholders in the marketplace have been pushed to think differently. So I think this is an opportunity for people to think out of the box and be creative and develop sustainable solutions for the market. Over. Thank you.
Yeah, thank you very much, Verena. Thank you, the panelists. This is the end of our panel presentation, but as the COP of Wihaze, I wouldn't want to close without leaving any room for some questions. So if you have any questions, please feel free to raise them now.
Dennis, I have a question for you. You know, I really liked Verena's point about trying to run an unorganized system in an organized way. And she also spoke a lot about the multi-sectoral, multidisciplinary nature of this team. And I guess I would ask you, how much have you felt like running the project is managing an unorganized system in an organized way, and what have been some of the challenges you've had in bringing together this multidisciplinary team with their different perspectives to look at this common problem and have that work in an integrated way? What have been some of the challenges or successes of that?
Yeah, good question there. Yeah, of course, I would say it all hasn't been rosy as one would wish, but I must say the task at hand demanded such a multidisciplinary team. So I think beginning with that acknowledgement is a good starting point. But I already mentioned earlier, we adopted what we call a one-team approach, with the clarity of tasks being one of the critical factors, so that between the teams and within the teams, we know who is responsible for what and within what timelines. So that has been important for us moving through at least the first year. But also, as Adriano mentioned at some point, I think learning has been critical. So each of us within the teams and between the teams, we have been open to learn as individuals and teams at the same time. But I must say that overall, it comes down to a strong and committed leadership across the board within the consortium that has been instrumental in making sure that we got started and got running quickly. But I must say again, there is always challenges. In this particular case, I think there's quite an amount of analysis that needs to happen. So it's been important for teams to adapt to a bit of a different way to work. So learning to work from a research point and knowledge management and so on, that has come with its challenges. It's slowing down a little bit on the implementation. And further still, I think with COVID-19, we have been challenged to another level. But I kind of would like to appreciate the amount of effort the teams have put in to adapt, to put into place and into use various tools to keep the team flowing. Overall, I must say it's been an exciting time, and we look forward to the next 4 years of implementation. Thank you very much. Now, as we wrap up this session, I want to kind of invite our followers, all the listeners. We have our emails right up there. If you are interested in reaching out to any of us, those are our contact details. But most importantly, we look forward to connecting further with the participants on our SEEP Learning Discussion Board. Please be sure to join. We'll be there for the next 30 minutes. Live and throughout the rest of the conference to learn from you and answer your questions. So thank you very much once again, the panelists. Thank you, the participants. We look forward to seeing you in the discussion on the discussion board. Thank you very much.
Thanks, Dennis.
Thank you.